Let me ask you something simple. What did you eat for breakfast this morning? Because there is a very real chance that what you put on your plate before 9 a.m. is deciding your blood sugar numbers for the entire rest of the day. And nobody ever explained that to you in plain language. Most people over 60 who are struggling with their blood sugar have been given the same advice over and over again. Cut the carbs, avoid sugar, eat less. And when that doesn't work well enough, they're handed a prescription and sent home. I have seen this happen hundreds of times. And the most frustrating part for me as a doctor is that the conversation almost never includes what you should be adding to your plate. Because adding the right foods can be just as powerful as removing the wrong ones, sometimes even more powerful. I'm Dr. Michael Lin, and welcome back to Dr. Michael Lin Senior Health. Today we are going through 10 foods that research and clinical experience both suggest may help lower blood sugar, improve how your body responds to insulin, and support steadier energy throughout the day. And I'm going to explain exactly how each one works inside your body, because when you understand the why, you're far more likely to actually use it. And I'm going to give you a simple action plan at the end, so you know exactly where to start tonight. Before we get into the list, I want you to do one thing. In the comments below, tell me your age and tell me what your fasting blood sugar number was this morning. If you check it, share it. I read every comment, and the numbers and experiences you share genuinely shape what I cover next on this channel. Now let me explain something first, because this is the foundation that makes everything else make sense. High blood sugar in older adults almost always starts with a problem called insulin resistance. Here is how to think about it. Insulin is a hormone your pancreas makes, and its job is to act like a key. It unlocks the door of your cells so that glucose, the sugar in your blood, can move out of your bloodstream and into the cell where it gets used as energy. When everything is working properly, you eat a meal, your blood sugar rises gently, insulin unlocks the cells, glucose moves in, and your blood sugar comes back down smoothly. But when you have been riding the blood sugar roller coaster for years, your cells start ignoring that knock at the door. The insulin knocks, and the cell stays shut. Your pancreas responds by making more and more insulin, your blood sugar stays high anyway, and over time, the entire system gets exhausted. That is insulin resistance. What the 10 foods in this video do is each tackle one piece of that problem. Some slow down how fast sugar enters your blood in the first place, so there's never a flood to deal with. Some cool down the inflammation that keeps your cells from hearing insulin signal, and some actually help wake your insulin receptors back up so your own body can start doing the work it was designed to do. You do not need to add all 10 tomorrow. Work them in over the next couple of weeks, stack them together, and pay attention to how your numbers respond. Let's get into the first one. Number one is fenugreek seeds. I know the name sounds exotic, but I want you to stay with me here, because if you walk past this one, you are leaving one of the most effective blood sugar tools on the market sitting on the shelf for just a couple of dollars. You can find fenugreek seeds in the spice aisle of most grocery stores, and many people have never even looked at them. Here's what they do. Fenugreek seeds are packed with a type of soluble fiber called galactomannan. When those seeds meet the water in your stomach, that fiber swells into a thick, slow-moving gel, and that gel does something remarkable. It physically wraps around the carbohydrates in your meal and slows down how quickly your stomach empties them into your small intestine. Instead of a flood of sugar rushing into your bloodstream all at once, you get a slow, steady trickle. No flood means no giant spike, and no giant spike means your pancreas doesn't have to panic and dump a huge wave of insulin. On top of that, fenugreek contains a natural amino acid that nudges the pancreas to release insulin more efficiently, and it helps your muscle cells pull glucose in from the blood. I have watched fasting numbers begin to improve within 1 to 2 weeks in patients who use this consistently. To use it, take 1 teaspoon of the whole seeds and soak them in a glass of water overnight. In the morning, drink the water and chew the softened seeds before breakfast. If the slightly bitter taste is too much, grind them finely and stir half a teaspoon into yogurt, or sprinkle them over your eggs. Start small. This fiber is strong and your digestive system needs a few days to adjust. Number 2 is Ceylon cinnamon. You almost certainly have cinnamon in your kitchen right now, but there's a good chance you have the wrong kind. And the difference matters more than most people realize. The cinnamon you find most often in grocery stores is called cassia cinnamon. It contains a compound called coumarin, which can be hard on the liver when taken in daily doses over a long period. The kind you want is called Ceylon cinnamon, sometimes labeled as true cinnamon. It is lighter in color, slightly milder in taste, and it is the safe version for daily use. Ceylon cinnamon contains a group of natural plant compounds called polyphenols. These compounds behave almost like a gentle version of insulin on their own. They help your insulin receptors grip glucose more firmly, and they slow the rate at which your stomach empties after a meal, which helps flatten the spike after eating. Research from the Human Nutrition Program at the USDA found that less than half a teaspoon a day meaningfully lowered fasting glucose in adults with type 2 diabetes. That is a measurable result from something that costs a few dollars and stirs right into your morning coffee or oatmeal. Use a quarter to a half teaspoon of Ceylon cinnamon daily. Pair it with a meal that has carbohydrates in it, because that is exactly when you want your receptors gripping more firmly and your digestion slowing down. Look for Ceylon cinnamon specifically at a health food store or online, because it may not always be clearly labeled at a regular grocery store. Number 3 is broccoli sprouts, and this one surprises almost everyone. I'm not talking about regular broccoli, which is excellent in its own right. I'm talking about the tiny 3-day-old sprouts you sometimes see in a small container in the produce section. The difference matters enormously. Broccoli sprouts contain a compound called sulforaphane, and here's the remarkable part. The young sprouts contain somewhere between 50 and 100 times more sulforaphane than a fully grown head of broccoli. It is one of the most concentrated sources of this compound that exists in food. What sulforaphane does that sets it apart from everything else on this list is that it goes directly to the liver and helps quiet down what I call the overnight glucose factory. Your liver produces sugar while you sleep. In a healthy body, it produces just enough to keep your brain fueled through the night. But in someone with insulin resistance, the liver overproduces sugar all night long, which is why so many people wake up with a high fasting number even after not eating for 8 hours. They're confused by it. Their doctor is sometimes confused by it. And the answer is often sitting right there in the liver. A study from Lund University in Sweden found that concentrated sulforaphane measurably reduced fasting blood sugar in people with type 2 diabetes, with the strongest effect in the people whose numbers were hardest to control. That is exactly the population that needs the most help. A small handful, about a quarter cup, on a salad or sandwich most days is enough. Do not cook them at high heat, because that destroys the active compound. Eat them raw or very lightly steamed. But wait, the next few foods on this list are ones you can start working into the meals you are already eating today. And together they begin to change how every meal lands in your body. Number 4 is avocado. For years, people were warned away from avocado because of the fat and the calories. That advice cost a lot of people a powerful tool. Here is the truth about avocado fat. The fat in an avocado is called monounsaturated fat, the same family as olive oil, and this fat is one of the most blood sugar-friendly things you can put on a plate, for one simple reason. Fat slows everything down. When you add half an avocado to a meal that contains carbohydrates, the fat and fiber in that avocado slow down your entire digestive process. The carbohydrates in your meal are absorbed more gradually, glucose enters your blood in a gentle rise rather than a spike, and your pancreas gets to respond calmly instead of rushing to keep up. Over time, monounsaturated fat has also been shown in research to improve insulin sensitivity, meaning your cells begin answering insulin signal a little faster and more reliably. There is also a very practical benefit. Avocado is filling. It has fiber, healthy fat, and it satisfies hunger. When you eat half an avocado with your eggs in the morning, you are far less likely to be rummaging through the kitchen for a snack at 10 o'clock. That steadiness carries through the whole day. Half an avocado a day is a sensible amount. Put it on your eggs in the morning, mash it on whole grain toast, or slice it into a salad that has a starch in it. Anywhere there is a carbohydrate on your plate, an avocado helps soften the impact. Number 5 is chia seeds. These are tiny, but they are remarkable. If you have ever dropped chia seeds into water and watched them turn into a thick gel within a few minutes, you have already seen exactly how they work inside your digestive system. Chia is one of the richest sources of soluble fiber available in any food. When they hit the water in your stomach, they form that thick gel that wraps around the carbohydrates in your meal and slows their absorption dramatically. Sugar enters your bloodstream slowly and steadily instead of all at once. You avoid the sharp spike and the crash that leaves you tired, shaky, and hungry an hour after eating. Chia seeds also contain a plant-based omega-3 fat that helps calm the low-grade inflammation sitting underneath insulin resistance. This is important because that chronic, quiet inflammation is one of the main reasons cells stop responding to insulin properly. Cool the inflammation, and the cells gradually start listening again. 1 to 2 tablespoons a day is enough. Stir them into yogurt, add them to a glass of water with a squeeze of lemon, and let them sit for 10 minutes before drinking, or blend them into a smoothie. Just remember to drink plenty of water alongside them, because all that fiber needs liquid to move properly through your system. Number 6 is fatty fish, and specifically I mean salmon and mackerel. This one works differently from everything else on this list. It does not slow your meal down or wrap around your carbohydrates. Instead, it goes after the deeper problem, the chronic inflammation that caused your cells to stop responding to insulin in the first place. Insulin resistance does not just happen because of sugar. It is driven in a significant way by years of low-grade inflammation running quietly through your body. That inflammation physically interferes with the insulin signal at the surface of the cell, like static on a telephone line. The message is being sent, but the cell cannot hear it clearly. Salmon and mackerel are loaded with 2 omega-3 fatty acids called EPA and DHA. These are among the most well-researched natural anti-inflammatory compounds we have. They reduce the inflammatory signals in your blood, help the cell membrane become healthier and more responsive, and the insulin receptor begins functioning the way it was designed to function. In my practice, patients who eat fatty fish consistently twice a week tend to have calmer, more stable numbers over time and better blood pressure along with it. Aim for 2 servings a week, roughly the size of your palm each time. Salmon, mackerel, sardines, and herring are all excellent choices. Canned mackerel and sardines are some of the most affordable and effective foods on this entire list, so budget is no barrier here. Quick pause. If this video is giving you useful information, take 1 second and tap the like button. It genuinely helps this content reach more seniors who are looking for clear, trustworthy answers. And while you are there, drop a comment telling me which of these foods you are going to try first. I read every single one. Number 7 is walnuts. Of all the nuts available to you, this is the one I point my patients toward first, for 2 specific reasons. Walnuts are rich in polyunsaturated fat and in plant-based omega-3, similar to chia. That fat improves the function of your endothelium, the thin inner lining of your blood vessels, which is one of the first places high blood sugar causes damage over time. At the same time, the combination of healthy fat, fiber, and protein in walnuts blunts the rise in blood sugar after a meal and has been shown in research to lower fasting insulin levels. Fasting insulin is the number underneath your blood sugar reading that tells your doctor how hard your pancreas is straining to keep your levels controlled. When that number comes down, the whole system is under less pressure. A small handful of raw or dry roasted walnuts as a snack instead of crackers or a cookie is one of the simplest swaps you can make. About a quarter cup or 7 to 10 whole walnuts is plenty. The important word there is instead, not in addition to, because you are replacing a processed snack that spikes your sugar with one that flattens it. Number 8 is whole eggs, yolk included. For many years, people were told to avoid the yolk, and that fear pushed a lot of older adults toward breakfast cereals and toast that were doing far more damage to their blood sugar than any egg ever could. Let me be straightforward. A whole egg contains almost no carbohydrate. On its own, it barely moves your blood sugar at all. But here's the part that makes eggs particularly powerful for blood sugar management, and it is something researchers call the second meal effect. When you start your morning with eggs instead of cereal, bread, or a muffin, you stabilize not just your breakfast blood sugar, but your blood sugar for the entire morning and into lunch. You walk into your next meal with calmer, lower baseline numbers, and the spike from that meal is smaller as a result. The protein and fat in eggs also keep you full and satisfied for hours. The mid-morning hunger that sends people reaching for something sweet or processed quietly disappears. In my clinical experience, swapping a carbohydrate-heavy breakfast for 2 or 3 whole eggs is one of the single fastest changes I see reflected in a morning glucose reading, sometimes within just a few days. 2 to 3 whole eggs scrambled, boiled ahead of time for the week, or folded with some spinach as a solid daily target. Put that avocado from number 4 right on top, and you have built one of the best blood sugar breakfasts available. Number 9 is apple cider vinegar. This is the one with the fastest visible effect on a glucose meter of anything on this entire list. If you have a meter at home, you can actually watch this one work the same day you try it. The active ingredient in apple cider vinegar is acetic acid. It does 2 important things simultaneously. First, it slows your stomach from emptying after a meal, so the carbohydrates arrive in your blood gradually rather than all at once. Second, it helps your muscles pull glucose out of your bloodstream and use it for fuel more efficiently. Research led by Dr. Carol Johnston at Arizona State University found that a tablespoon of vinegar taken before a carbohydrate meal reduced the after-meal blood sugar spike by roughly 20% in people with insulin resistance. That is a meaningful, measurable result from something that costs just a few dollars a bottle. Take 1 tablespoon, dilute it in a full glass of water 10 to 15 minutes before a meal that contains carbohydrates. Always dilute it. Never drink it straight, because the acid can damage tooth enamel and irritate the throat and esophagus. And if you are already on a blood sugar medication, please speak with your doctor before adding this, because vinegar combined with certain medications can lower your sugar faster than expected, and you need someone monitoring your numbers during that adjustment. Number 10 is lentils, and this food proves the whole point of everything we have covered today. Lentils are a carbohydrate. They will lower your blood sugar. That might sound like a contradiction, but it is not. Lentils are built from a slow carbohydrate called resistant starch, wrapped in soluble fiber with a substantial amount of plant protein alongside it. That combination means the glucose inside a lentil is released into your bloodstream over hours rather than minutes. It is a long, steady trickle instead of a wave. Your blood sugar climbs gently, your insulin handles it calmly, and everything stays stable. Lentils also carry that second meal effect we talked about with eggs. A bowl of lentil soup at lunch can help keep your blood sugar steadier well into the evening. And for people trying to bring down their A1C, which is the 3-month average blood sugar reading your doctor checks, swapping white rice or white potato for lentils several times a week is one of the most reliable ways I know to move that number in the right direction over time. Half a cup to a full cup of cooked lentils a few times a week is a great target. Use them in soup, in a stew, in a cold salad dressed with olive oil, and a splash of the apple cider vinegar we just covered. They are filling, they are affordable, and they stretch a meal further than almost anything else. Now, before I give you tonight's action plan, I want to tell you about someone I will call Margaret. She was 67, recently retired, and came to see me worried because her fasting blood sugar had been sitting around 175, and her doctor was starting the conversation about adding a second medication. Margaret was frightened, not just because of the numbers, but because she had watched her older sister lose her independence to this disease, and she was determined to take a different path. We did not strip her plate bare. We did not tell her to never eat a carbohydrate again. What we did was add eggs and avocado in the morning instead of toast and jam, a teaspoon of fenugreek soaked overnight and taken before breakfast, Ceylon cinnamon in her coffee, a tablespoon of apple cider vinegar before her biggest meal of the day, lentils in place of white rice twice a week, walnuts in the afternoon instead of crackers, fatty fish twice a week for dinner, broccoli sprouts on her lunchtime sandwich. Within the first week, her fasting numbers began to move. Within 3 months, working closely with her own doctor, her A1C had come down significantly, and the conversation about a second medication was replaced by a conversation about whether she still needed the first one at full strength. 2 years on, her numbers have held steady. She did not starve herself. She ate more food, just the right food. So here's your simple action plan for tonight and this week, because I want you to walk away from this video with something you can actually use. Tomorrow morning, replace your cereal, your toast, or whatever carbohydrate you usually start with, and instead make 2 or 3 whole eggs with half an avocado. That single swap may begin to change your blood sugar reading not just at breakfast, but for the entire day. Tonight, take 1 teaspoon of fenugreek seeds and soak them in a glass of water. Drink the water and eat the seeds first thing tomorrow morning before breakfast. This week, find Ceylon cinnamon, not cassia, and start a 1/4 teaspoon a day, stirred into your coffee or oatmeal. Before your biggest carbohydrate meal tomorrow, mix 1 tablespoon of apple cider vinegar into a full glass of water and drink it 15 minutes before you sit down to eat. And this week, swap white rice or white potato for lentils at least twice, and put fatty fish on the dinner menu 2 nights. Work the rest of the list in gradually over the next 2 weeks. You are not removing the foods you love. You are adding the foods that protect you, and there is a real difference between those 2 approaches. One feels like punishment. The other feels like you are finally doing something good for yourself. One important note before we finish, and I want to be direct with you about this. If you are currently taking insulin or any blood sugar medication, these foods can lower your numbers meaningfully, and they can do it relatively quickly. That means your current medication dose may begin to feel too strong as your body improves, and that can push your sugar too low. This is not a reason to avoid these foods. It is a reason to add them while your doctor is watching your numbers and adjusting your medication alongside you. Never stop a prescription on your own. Bring this list to your next appointment and ask your doctor to monitor your numbers as you make these changes. That is the right way to do this, and it is how my patients have seen the best, safest, longest lasting results. Now, I'd love to hear from you. Which of these 10 foods are you going to try first? And are any of them already part of your daily routine? Tell me in the comments below, because your answer genuinely helps me understand what this community needs more of. Remember, this video is for educational and informational purposes only, and is not intended to diagnose, treat, cure, or prevent any disease. Please consult your personal doctor or a qualified healthcare professional before making any changes to your diet, health, routine, or medications. If you found this video helpful, don't forget to subscribe to Dr. Michael Lynn Senior Health and hit the notification bell so you never miss a health tip. I'll see you in the next video.